introduce our speaker today. Assalamu alaikum.
A'udhu billahi shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum, and thank you very much for coming this early. We are very fortunate to have Dr. Wasima Masoodi, our own Dr. Wasima Masoodi, and most of us know her. She is a board-certified endocrinologist in Lomita, California. She specializes in diabetes, metabolism, and thyroid disorders. She has over 25 years of experience. She's affiliated with Torrance Memorial Medical Center and Providence Little Company of Mary in Torrance. Her practice is located, which is known as Endocrine Care Specialist, is located in Lomita. She's a fellow of the American College of Endocrinology and is certified in thyroid, ultrasonography, and fine needle aspiration biopsy. Please welcome Dr. Masoodi. Thank you so much.
Sister Rehana, for the introduction.
Can I just use this? Does that work? Let me just fine.
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. My name is Wasima Masoodi. I'm adult endocrinologist in private practice just around the corner in your neighborhood here in Lomita. And I've been doing this for about 26 years now. So a few months ago, Brother Rohan asked me to talk about diabetes and have a workshop about diabetes. Diabetes is a vast topic. It includes many lectures. So what I'm going to try to do today is just to give you an outline of the disease. And if you feel the information is beneficial for you, then in future, inshallah, we can talk more in depth about a particular topic, whatever you are interested in. So diabetes is a disease of abnormality of glucose metabolism. Glucose is also called sugar. It's the main source of energy for your body. So your body has millions and trillions of small cells. All these cells, so you have muscle cell, you have heart cell, fat cell, every cell in the body, it needs sugar in order to function. So in front of your cells, you have these doors. As soon as your sugar level in the blood increases, the body makes insulin, and insulin helps open these doors to the cells. We are facing a pandemic of diabetes. So pandemic means when a disease is widespread all over the world, it's called pandemic. Just like we had a COVID pandemic, we have a diabetes pandemic right now. The only difference is COVID lasted for only a short time, but diabetes is unfortunately here to stay for several years. So, right now, we have about 98 million people in the US that are diagnosed with diabetes. That's about 1 in 10 people. And unfortunately, 1 in 5 people don't know that they have the disease. The stage before diabetes that's more prevalent, it's called pre-diabetes. That's the stage where your blood sugar is slightly high, you don't know about it, but the risk has already started. So we have 98 million American adults, which is more than 1 in 3 people who have diabetes. And about 8 out of 10 people, unfortunately, don't know that they have pre-diabetes. So it all starts, so glucose metabolism starts from a gland that sits under your stomach. It's called the pancreas. It's a leaf-shaped gland that makes insulin. Insulin is a hormone or chemical that helps push the sugar inside your cells. So as mentioned, when you eat your food, the food gets digested. So it depends on the kind of food you ate, whether it's starch, it's protein, it's fat. The rate at which your blood sugar increases depends on what kind of food you eat. If you eat more starch, the food will get absorbed faster and the sugar level will rise faster. As compared to that, if you eat protein or fat, the sugar level will go up slowly. So as you can see in the picture, the blue round molecules, those are your insulin molecules. They help open the doors to your cells so the sugar can go inside. If the insulin molecule is absent for any reason, like in type 1 diabetes, the body doesn't have insulin, so the sugar cannot go inside the cell, or in type 2 diabetes where you have insulin resistance, the doors cannot open. So the blood sugar stays high in the blood, and that causes damage to your blood vessels. So there are two types of diabetes. There's type 1 diabetes that usually happens in childhood and very young kids, but we also can see this type of, it's autoimmune, where your immune system starts attacking your organs, and in this case, it attacks the pancreas. So it starts in early childhood, but we have also seen it in late life, like up to 80 years of age. Type 2 diabetes, we call it the diabetes of prosperity. In a genetically predisposed person where they have family history, they have strong genetic history, in the right environment, they start getting insulin resistance, and then they start developing diabetes. So the symptoms of diabetes are more pronounced in type 1 diabetes, which is autoimmune diabetes. People feel thirsty, they go to the bathroom a lot, they feel hungry all the time, or they have wounds that don't heal, or they get extreme weight loss, they get other like nerve problems. With type 2 diabetes, unfortunately, it's a very silent disease. People who don't go to their doctor regularly to get checked yearly, it just shows a one fine day, and people generally have the disease for 4 or 5 years by the time they're diagnosed. So how do you diagnose diabetes? So you have to have 2 abnormal tests. Like we were just checking your blood sugars outside. So if you have a fasting blood sugar more than 126, you have to repeat it on another occasion, or you can do another test. There's a test called hemoglobin A1C. Somebody was asking me what the A1C test is. It's a test that tells us how your blood sugar was for past 3 months. So your sugar binds to the hemoglobin on your red blood cell, and we extract that hemoglobin that has sugar attached to it. So it tells us for the past 3 months how your sugar was. So if your hemoglobin A1C is more than 6.5, that's a diagnostic of diabetes, or at any point if your sugar is more than 200, that's diagnostic of diabetes. Sometimes there's a gray zone, we're not sure, maybe not. Then we do a glucose tolerance test where you have a glucose drink, and then we check your blood sugar in 1 hour and 2 hours. If it's more than 200, that's diagnostic of diabetes. So normal blood sugar, I often get asked this question. Normal blood sugar for a person who doesn't have diabetes, when they wake up in the morning, is 70 to 100. 2 hours after you eat a meal, it should be below 140. But when somebody has diabetes, that number goes high. So pre-diabetes is when your fasting sugar is 101 to 125, and 2 hours after is 140 to 200. And diabetes is when your fasting sugar is more than 126, or 2-hour blood sugar is more than 200. So if you belong to one of these high-risk groups and you haven't been tested, or your family belongs to this group, you should get tested. Anybody who is over 45 years of age, anybody who has a metabolic syndrome means you're overweight, you have high cholesterol, you have high blood pressure, and you have more weight in the abdominal area, or we have young girls who have polycystic ovary disease, there's high blood pressure, people have diabetes during pregnancy, or there are high-risk groups like Hispanics, African Americans, Asian Americans, they are at high risk of developing diabetes. So diabetes is a disease of your blood vessels. It's a very ugly disease. Unfortunately, just like termite, it eats your body. You're on the outside, you're fine, and one fine day, boom, we end up with problems. So when your sugar shoots up too high, you get a spike after you drink that orange juice. It hits the walls of your blood vessels just like a bullet. And there's a dent in the wall, and then the blood cells, they come in to seal that. The fat cells come, the fiber cells come, and they try to seal it, and then they create a clot, and the blood vessels start narrowing. And you can imagine you have blood vessels all over your body. If there's narrowing in any blood vessels, it's going to slow down the blood supply to that organ. So the economic burden of diabetes is huge. Right now, we are spending about $413 billion for the management of diabetes in this country, which is double that of people who don't have diabetes. So diabetes can cause serious complications. It can cause heart attack, stroke. People lose their kidneys. You lose your vision. People get blind. You can lose your toes. You can get amputation. If normally, if you get an infection, a simple infection, it will heal fast. But for a patient with diabetes, because their sugar is so high, the bugs love the sugar. If you're infected, you have a bacterial viral infection, the bugs like to party on that. So they stay there. So normally a common cold or bronchitis, if it will last for a week, for a patient with diabetes, it will last to 2 weeks, or it can progress to pneumonia or serious infection. So the risk of heart attacks is very high, especially silent heart attacks. People with diabetes sometimes don't get typical symptoms of chest pain. They sometimes will get some nausea, they'll get some jaw pain. I have had young 30, 40-year-old patients who were ready to go to work, sitting, watching TV, and boom, they were gone. Sudden heart attack. And people watching TV, the family came to check on them, and they were gone. It's a really serious disease. It's the commonest cause of heart attacks. Diabetes causes strokes, again, from blockage of blood vessels. And loss of blood vessels to the lower extremities causes gangrene, and then the toes have to be amputated, or if it has progressed, sometimes the legs have to be amputated. Next. And it can also cause foot ulcers. So from 2009 to 2019, diabetes-related hospitalization due to amputations have doubled almost. So diabetes causes amputations, as mentioned. So it's very important for a person with diabetes to check their feet, check for calluses, check for ulcers, and never walk without shoes. So once you're diagnosed with diabetes, we want to keep your blood sugar before meal between 70 to 110, 2 hours after you eat, and that's 2 hours from when you start eating. So you start your breakfast at 8 o'clock, exactly at 10. If you check your blood sugar, it should be ideally, it also depends on your age and your comorbidity. If you are an elderly person, if you are at high risk for low blood sugars, then we try to relax the blood sugar goals a little bit. But if you are a young person, we want to keep your blood sugar below 140 at 2 hours. Otherwise, you can keep it up to 160, but maximum, you never want it to go above 180. So these two numbers you have to remember. You don't ever want your blood sugar going below 70. You never want it to go above 180. So technology has revolutionized the treatment of diabetes. So gone are the days when you had to prick your fingers 10 times a day, 6 times a day, and your fingers would be numb, you would bleed. We now have a wide variety of continuous glucose sensors. So these are devices that you stick on your arm or abdomen, and they monitor your blood sugar for 10 days, for 15 days, and they use Bluetooth technology. So the information from your blood is transmitted to the phone, or you can also share that data with your family members, your friends, and your doctor. So anytime your blood sugar goes too high, too low, it will beep, or there will be an alarm. This is a typical example of a reading from a continuous glucose sensor. So every time you eat, you will get a nice graph. It gives you a lot of valuable information. It will give you a nice increase, spike in the blood sugar. So it's a great behavior modification tool. If you don't have diabetes, you can also get an over-the-counter sensor and wear it, and get information about what foods you're eating and what it's doing to your blood sugars. So after you're diagnosed with diabetes, depending on your comorbidities, like I said, if you're an elderly person, you're at high risk of low blood sugar, we want to keep the blood sugar above 6.5. So otherwise, if you're a young person, we usually try to be aggressive. We want to keep it tighter. So our body has a memory. When you're diagnosed with diabetes, within the first 5 years of diagnosis, it's very important to be aggressive at that time and bring the blood sugar down. If you're lazy at that time, you say, okay, I don't want to take medicine, I don't want to exercise, we'll do it later on, it's not too bad. Those initial 5 years is the body has a memory and you can reduce your risk of complication. But if you wait for later time, after 5-10 years, the damage is already done. So your complications have already set in. I mean, you can still control your diabetes, but you cannot reverse the damage. So this is called the legacy effect, which means the body has a memory of how the sugar was. So the treatment is, the lifestyle modification is the treatment for diabetes. I can't stress it enough how important, because a majority of our patients have type 2 diabetes, more than 95% of patients. So lifestyle modification is very important. You have to exercise at least half an hour every day. It doesn't have to be anything fancy. You don't have to go to a gym. You don't need to get a personal trainer. You can walk. You can walk inside the house. We have Fitbits. Most phones these days, they have a health app and you can count your steps. Try to do at least 5,000 steps every day. You can walk around the block. Anytime somebody calls you on your phone, you get up and start walking, pacing around inside the house, inside your kitchen, wherever. As long as you keep the body moving, you go out, you walk, park your car further, go up and down the stairs, swim, whatever you like to do, bicycling, do that. But move, don't sit on the couch. That is going to hurt you in the long run and that will raise your blood sugar. We need to, with the diet, we need to make sure we reduce our simple sugars. Simple sugars are like processed sugars, our juices, sodas, and eating candies, chocolate, and white foods. White foods are like a rice, pasta, potatoes, French fries, ice creams, chocolates, pastries, bakery, all bakery, cakes, cookies, donuts, muffins. Those are all loaded with simple sugars. We want to avoid those. So just to summarize, we want to eat a balanced diet and we exercise. And then if anybody is smoking and diabetes is a heart attack waiting to happen. They both damage blood vessels, so we want to stop as soon as possible. So this is your typical 9-inch dinner plate. Half of your plate has to be green leafy vegetables, salads. The point is that you want to have more fiber in your diet. You want to have non-starchy vegetables. Fiber will hold your blood sugar. Then 1/4 of your meal has to be protein. Protein is really important because it gets digested really slowly and it releases the sugar as a slow trickle rather than giving you a big spike. The spikes in your blood sugar are dangerous for your blood vessel. So a good protein would be chicken, fish, turkey, lentils, beans, quinoa, hummus, nuts like almonds, walnuts, pistachios, peanuts, whatever protein you can eat, or sugar-free peanut butter, you can eat that. And then carbohydrates or starch, it should be only 25% of your meal. If you do want to eat rice, start by eating a salad or a protein. And then you can add a rice later on, but the amount of rice should be really like half a cup of cooked rice. But always go for starches that are high in fiber, whole grain bread, wheat bread, things like that, or oatmeal and quinoa, things like that. We have a big menu of diabetes drugs available right now. You can talk about those with your healthcare provider. Um, the most important, I call them the wonder drugs of 21st century. These drugs are the GLP-1 analogs. These are your everyday Mounjaro and Ozempic. These drugs have a lot of useful effects on the body. They increase your insulin production. The cells that make insulin, called beta cells, they get damaged over time. They help them proliferate and grow. They help reduce the absorption of sugar from your gastrointestinal tract. They reduce your risk of heart attacks. They cause weight loss. But these drugs have to be taken under supervision of a medical professional. You don't want to take these drugs on your own off the market. Right now there are a lot of clinics, a lot of black market with these drugs. You don't want to take these drugs because some patients, if you have history of pancreatitis, if you have family history of medullary thyroid cancer, if you're pregnant, if you have history of gastroparesis, that's a condition where your gastric motility decreases, you do not want to take these drugs. If you have history of gallstones, you do not want to take these drugs. These drugs have side effects, so you have to really initiate it under a doctor's supervision, and they have to be started slowly. And then you gradually increase the dose based on how you're tolerating it. The commonest side effect is nausea, but nausea usually goes away. Usually people don't get it with the low dose, and it goes away after a few hours, or sometime maybe a day or two, then it will go away. But the weight loss is robust with these medications, and the overall cardiac protection and the benefit you get from weight loss. So, generally we tell patients, once you have lost, so research has shown that if you lose 5 to 10% of your weight, that helps you metabolically, that helps improve your diabetes control, high blood pressure, heart attack risk, cholesterol. So if you use it even for 3 to 6 months and you have lost enough weight, you have lost 5 to 10% of your weight, you can always stop it. It's not like a medication where you cannot stop it and you have to take it for life. You just sometimes need that slight nudge to lower that weight, and that will benefit your body, that will reduce your overall risk. So metformin is usually the first line treatment given to people with type 2 diabetes. So then we have other drugs. For type 1 diabetes, we have insulin. So normally when a person eats, our body constantly makes insulin, and then every time we eat, there's a spike in insulin. The body makes some extra insulin. So we try to, when we give somebody insulin, we try to mimic the body's natural rhythm. So we now have inhaled insulin available, but not many people use it because it's a little difficult to use around meal time, and you have to get lung function tests, so it's not very popular. We have insulin, people use it with syringes, people use it with pre-filled pens. You can do it 4 times a day. Generally, people who use insulin 4 times a day, we advise them to go on an insulin pump. We now have a variety of insulin pumps, and they closely mimic what the body's natural insulin production rhythm is. So there's a closed loop system. You wear a sensor, and the sensor talks to your pump, and it tells the pump if your blood sugar is going high, it will give you a little extra insulin. It will give you mini boluses of insulin. If your sugar is about to drop, 2 to 3 hours before that, the pump will stop, and so the person doesn't get low blood sugar. It has really improved diabetes control. So these are different pumps in the market. So these are the 3 A, B, and C that I want you to take home from today. If you or anybody in your family is diagnosed with diabetes, A is your A1C. American Diabetes Association says your A1C should be below 7 for you to be in a safe zone where you reduce your complication. B is your blood pressure. For people with diabetes, we want your blood pressure below 130/80. because high blood pressure will increase your risk. And then there is cholesterol. When you check your fasting lipid panel, we want your LDL, the bad cholesterol, below 70. People who have history of heart disease or stroke, we try to keep their LDL below 55. So in those situations, we have to be a little bit more aggressive. So for follow-up care, you have to make sure you see your doctor. It could be a primary care physician. It could be your endocrinologist. If your diabetes control is excellent, you can see them 3 times a year, every 4 months. If your diabetes control is bad, the doctor will tell you to come back maybe in 1 month, 2 months, or you can see them every 3 months. You want to make sure you get your feet checked once a year. You check your kidney function, liver function, cholesterol, and blood pressure. And once a year, you have to go see your eye doctor. The reason for that is because diabetes affects the small blood vessels at the back of your eye. So you may not feel anything, but the ophthalmologist will put some drops in your eyes. They can look in the back of your eye, and if there's already damage there, they can fix it right there. But if you don't go see the eye doctor, it can cause blindness. The blood vessels can rupture. Sometimes there can be detachment of the retina. That's the part of the eye where you can see. That can get detached, and people lose their vision because of that. So what you can do to prevent diabetes, you can increase your exercise, eat healthy, lose weight. Once you have been diagnosed with diabetes, you should regularly go see your doctor. You should eat healthy, and you should stay active. So coming to, so the blessed month of Ramadan is around the corner. Everybody, so we commonly get the question asked, should I fast? Can I fast? I want to fast. So you have to really fast. If you have diabetes, you have to fast under supervision of a medical professional. A lot of people are exempt from fasting, the sick, elderly, those who are traveling, pregnant, breastfeeding people. So I know everybody is spiritually charged and they want to get the blessings of the holy month of Ramadan, but we have to balance it with good health. And I mean, Allah wants us to do that too. We don't want to risk our life. But if you, right now, majority of the patients, whether you're on insulin, whether you're on oral pills, after discussing with your physician, majority of the people can fast. Only a very small minority of patients who have get severe episodes of low blood sugar, or they don't feel it, they pass out. They don't feel it when their blood sugar drops. Those patients, we advise them not to fast. But you should always go see your doctor, and they will evaluate your risk for low blood sugar, or what's a healthy way of fasting, and they will need to change your medication. So we still have a month to Ramadan. So if you haven't seen your doctor, you should go see the doctor and take their advice on what should I do during Ramadan. So during Ramadan, people with diabetes, they are at high risk of low blood sugar, which is called hypoglycemia, high blood sugar, hyperglycemia. They can get dehydrated. You can get blood clots from dehydration, and you can get diabetic ketoacidosis. So type 1 diabetes patients who are using insulin, if they don't manage their diabetes and they go on and fast and they are dehydrated, they can get acid formation in the body, and that can be dangerous and that can cause death. So we have to be very, very careful. So like I said, you go to your physician and they will assess your risk for diabetes. So they categorize you into a low risk, medium risk, or high risk patient. So if you're high risk, they will generally advise you not to fast, or depending on your circumstances, they will give you diet advice, insulin advice. But if you're low risk, you should be okay to fast, and they will give you advice about hydration and blood glucose monitoring. So during Ramadan, we usually recommend, Ramadan and diabetes in itself is a 1-hour talk, but I'm just giving you a general outline. So you should fast, you should test your blood sugar at sahur time, and then when you wake up early in the morning, then midday, in the afternoon, 1 or 2 hours before iftar, and then iftar time also, and then in the evening. There is an app, it's called Dar Safa. It's available on most smartphones. It gives you a lot of, it has been created by the International Diabetes Federation for Ramadan and diabetes. And they have a lot of useful information. There are videos from doctors there about diet and things you should do during Ramadan. And lastly, before closing, my humble request to the community. Ramadan is a time of fasting, not feasting. We tend to feast, we eat. It's like really, really uncomfortable seeing the amount of food we consume during Ramadan. There are so many juices, sharbat, ruh afza, those are all bad. Though not only for people with diabetes, though they are bad for everybody. We should not be drinking all that during Ramadan. We should have water. We can have fruit infused water. We can put water, fruit in the water, so you get the flavor. You can eat the fruit out of it. We can have kefir. We can have lemon water and keep the sugar really low. And we should really, really avoid eating all the fried foods. They're loaded with saturated fat, all the donuts we bring for kids. It's really, really painful to see. We are seeing kids as young as 8-year-olds with diabetes. We have 15, 20-year-old kids with fatty liver, diabetes, polycystic ovary disease. These are all diseases due to poor lifestyle. We as adults, we have to set an example. We have to change our eating. So generally, fasting is supposed to be a time of self-discipline, reflection. We end up coming out of Ramadan gaining 5 pounds more. It should be the other way around. So please, let's take it to our homes, our families, and advise everybody, our people who cook, advise everybody, don't get unhealthy desserts. For iftar, I mean, you can get fruit with like yogurt, Greek yogurt, or get chia seed pudding, or healthy desserts, or nuts, anything you like. But don't. Please, I request you, do not eat unhealthy food. I mean, I'm not saying after a long day of fasting, you should starve yourself, but I'm just saying don't eat unhealthy food, don't eat calorie dense food, don't eat bakery, and don't eat sugary food. Thank you so much for your attention. This is a picture of Kashmir, the place I'm from. This is the beauty of chinars.
Then, sir, if you-
Hello? Okay. Sure. Once you have the diagnosis of diabetes, it's not reversible. You have that disease for life, but you can reduce your risk by with lifestyle change. You can be a diet control diabetic, and I mean pre-diabetes you can reverse, but once diabetes sets in, you have the disease and it's there.
The second question is, what's the logic in asking of our
That's only because when you check your cholesterol, for that you have to fast. Because when you don't fast, your triglyceride is the part of your cholesterol that comes from sugar. When you don't fast, the triglyceride levels come up high, and triglycerides consume your good cholesterol. So you get a false low good cholesterol and high triglyceride, obviously. Whereas it may not be the case. If you fast, you may have normal triglycerides. So triglycerides itself is a risk for heart disease, high triglycerides. So it may lead to inadequate treatment, or treatment that you don't need.
So 8 hours, there's a
8
lot.
hours of fasting, yeah.
Okay, thank you.
Thank you, sister, for the information. I wanted to ask about what is the best sensor to buy, to check the blood sugar, and where do you find it?
Right now, we have two main sensors. We have the Freestyle Libre from Abbott. You wear it for 15 days. So unfortunately, in this country, everything is very expensive. So if you go to your doctor, they usually have a discount card. They will give you a discount card. You may get two sensors for maybe up to $60 to $70, and you can find them at any pharmacy. You can buy them cash, or you can have your doctor send a prescription. And Freestyle Libre you change after every 15 days. Then there is a Dexcom G7 sensor that you change every 10 days. But they also have an over-the-counter variety. One is called Stello, one is called Lingo. Those are $40 to $50, I think.
Reasonable. Thank you.
Yeah.
Doctor, can you briefly describe what is fatty liver and is it reversible?
Fatty liver is totally reversible. When you have any abnormality of the glucose metabolism, like I said, when your sugar is high, your triglycerides are high. Triglycerides are your sugar attached to lipids. So when your triglycerides are high, they get deposited in the liver. They cause inflammation there. They cause irritation to the substance of the liver. So the liver reacts by trying to combat that, and then over a period of time, if the inflammation continues, it causes scarring in the liver. And the scarring, with time, it causes end-stage liver disease or cirrhosis. Back in the days when diabetes was not so prevalent, we used to get cirrhosis from people who were alcoholics, people who were getting hepatitis C or A or any hepatitis. But in this day and age, because of our unhealthy eating, we get all the sugar gets deposited in the liver and we get fatty liver. Like I said, we see young people, 10, 15, 20-year-olds, then they get fatty liver. And yes, it's reversible. So fatty liver has stages. So initial 1 and 2 stages where the scarring has not set in, you can reverse it with aggressive exercise, changing diet, and improving your diabetes control. It can reverse and you can go back to normal. But once the scarring has set in, if you have chronic liver disease already, then you get complications because of that. Diabetes and metabolic diseases, unfortunately, the #1 reason for end-stage liver disease right now. And the only treatment we have, we just came up with a new drug that helps somewhat, but if this scarring has already set in, only treatment is liver transplant, and you know how hard that's to get.
I want to know if diabetes has a trait of hereditary, or is it you acquired it by wrong diet?
So,
or combination, I don't know.
It's in our genes. Genetically predisposed people, if you have family history, somebody in your family had diabetes. Sometimes we have very skinny people, they get diabetes too because it's in their gene. But majority of the times in a genetically predisposed people, like I said, there are high risk ethnic groups like Asians or Hispanics, African Americans, American Indians. Those people, it's already in their gene. So in the right environment, if you don't watch what you're eating, then it will set in, unfortunately. So in past, diabetes used to happen in 70s and 80s. But in these days, we're seeing it in 8 and 9-year-old kids.
Oh.
So type 1 diabetes, also there is some genetic component, usually twins, monozygotic twins. If one has type 1 diabetes, the other ends up getting it too. So there is a genetic predisposition there also.
Well, we see it in the children because of all these fast food, packaged foods.
Fast food, not exercising,
sugar is in everything.
Glued to their gadgets, not getting off of the couch and just sitting. We need to push them and to have them walk and do things with them.
Thank you.
I have a few questions. Assalamu alaikum, and thank you very much for the wonderful presentation. first just came right now. What is the ophthalmologist looking for in the back of the eye when you are diabetic or pre-diabetic?
So you don't need to go see, I mean, you can see the ophthalmologist for other reason, but you don't, screening is not recommended for pre-diabetes. It's only recommended for diabetes. So in the back of your eye, there's a layer of eye called retina. Mm-hmm. Retina is the layer where you have all the nerve cells that help us see, that sends a signal to the brain. And there are also blood vessels that nourish that layer of the eye. When there is diabetes, like I said, diabetes is a disease of your blood vessels. When there's diabetes, there's damage to those blood vessels. Those blood vessels start leaking, or sometimes they leak out protein from there. There's swelling in that part of the eye, or they multiply too much. So the body tries to compensate. So then there is fibrous tissue formation, and that retinal layer, it can detach. It can detach from the inside of the eyeball into the eyeball, and you lose your vision because the nerves are damaged. So you lose, people go blind because of that.
Thank you for the answer. I had a kidney transplant about 3 years ago for, thank God, alhamdulillah, overseas. And I became pre-diabetic because I have to take prednisone steroid, which I have to take for life, apparently. Okay, hold on. What is the best way to lose weight? Of course, we all know what it is. What shall I do to keep the glucose under control? You just saw, my glucose after an hour or so of breakfast was still 108. And my A1C is 6. And fasting sometimes when I go to the blood work is 106, the glucose. What can we do to keep it under control?
I mean, they can give you medications. You don't necessarily have to have injections. There are also a lot of good medications that can help, and there are medications that can help you lose weight also. But the weight loss may not be as robust as the injections, but right. You will lose weight.
Are injections recommended in my case with one transplanted kidney?
You can. Those are safe.
Any particular one?
It doesn't matter. It depends on what your insurance covers.
Is there something called test, like insulin resistance test?
That test is not very accurate. We do check fasting insulin levels but it's not a very accurate test. So if you really want to do check your insulin, you have to go to a research lab in a hospital, academic hospital setting, and they will start you on a glucose drip, and then they will monitor your insulin, and it's a cumbersome test, but fasting insulin is the poor man's insulin resistance test.
Okay, and the Dar Safa that you mentioned, is it a website?
It's an app.
It's an app.
They also have a website. They have done some amazing work on diabetes and Ramadan. Mm-hmm. So they have an app. On the app, you have videos, you have diet advice, what you should do during Ramadan, how you should check your sugar and everything.
Last question. Can I fast? I mean, this is a personal question. Because I have to take medication exactly 12 hours apart, and Ramadan fasting is about 14, 16 hours.
I'm not your doctor.
Okay.
I cannot give you that advice.
Thank you so much.
But I would recommend you should go see your primary care physician or endocrinologist. They can guide you based on your risk factors, everything. Yeah.
I asked my neurologist overseas, and he told me I should not.
No comments. I can't comment.
So in many cultures, rice is the main component of the food. What do you think about rice?
If you're eating rice, you have to walk. You have to exercise.
But is rice as
there's nothing wrong with rice. There's a problem with everything else we eat with rice. And all the calories we eat and all the sugar we take with rice. For rice, we have been eating it since childhood. I used to eat rice 3 times a day in my childhood. But, now we eat rice plus we eat pastries and chocolates and ice cream and don't walk, sit on the couch watching TV. So.
Nice.
How about dates in Ramadan?
So dates are, I know a lot of our Muslim brothers and sisters, we know it's sunnah, so we keep on eating. Okay, 3, 5, 7. So dates are a great source of minerals, fiber, energy, but we have to eat them in moderation. I would say somebody who has diabetes, they should eat only one.
All right. Assalamu alaikum.
Alaikum
So since brother mentioned Ramadan and dates, so I have a question and a comment. Because if we cannot start this and we have to, it's such an epidemic, like you mentioned, we have to start this in baby steps in a community. So can we all make a promise and then we all do all these petitions and everything to at least stop serving the Ruh Afza at masjids that is provided by masjid. We cannot control the people in their homes, but at least
Get them.
at least, yes, I'm just saying it because again, I love Ruh Afza. I was raised on Ruh Afza from Pakistan. But if we can stop at least one thing, that we will not serve Ruh Afza in this Ramadan and only serve water, then I can also donate a pallet of water.
That's wonderful. I
said
love that.
No, but if we start with one thing,
Yeah. Small changes.
That's a saving money for the masjid, actually. So it's a good suggestion.
We're good?
Anybody else?
We have more questions.
I don't know. Recently, I heard that milk is not good. Is that right?
In moderation. Milk has sugar also. Yeah. So you want to
regular
have
vitamin D
you
milk.
want to have small amounts. You can get vitamin D from fish. Fish, nuts, green leafy vegetables. Yeah. Just like people say, I have to get potassium from banana. Bananas raise your sugar a lot. So you should really eat them in moderation, or a small banana or maybe half a banana. But if you have low potassium, you eat other things. I mean, you eat green leafy vegetables. There are other sources of tomatoes.
Okay. Thank you.
Twice a week, size of your palm, like a deck of cards. Yeah. Yeah.
Thank you, Dr. Wasim Masoodi,
You're
for
welcome.
the interesting topic discussed, and there was a lot of questions, and I hope this will help you. And we plan to have more sessions like this every month, and inshallah, your participation, your contributions means a lot, so that we can continue doing this. Alhamdulillah, we'll get ready for Zohar prayers now. Assalamu alaikum. Please, there are apples and strawberries. Please help yourself. That's all for you. There you are. Once again, sister, thanks a lot for your. Thank you. Assalamu alaikum.